Right. Excellent. So my name is Sarah Fay, and I'm a student of physical therapy at the University of Washington. And I'm here today just to do a quick interview with you. We're just going to take about 20 or 25 minutes and get an idea of what's going on. Before we get started, would you mind verifying your full name and date of birth for me?
Your picture is frozen. Now you're back. Okay.
Oh, okay.
My name is Ainsley Taylor, and my birthday is December 21st, 1964.
December 21st?
December 21st, yep.
Okay. Excellent. And I'm just going to be typing here on my computer.
Okay.
So if I'm looking away from you, that is why. And is it okay if I call you Ainsley?
Ainsley, yeah, of course,
okay.
You bet.
Ainsley, perfect. And is English your primary language you speak?
It is.
Okay. So like I said, today we're just going to do a quick sort of interview. I know that you were referred from Dr. Muntz, was it? Regarding your shoulder.
Mm-hmm.
And so what I'd like to do first is just ask, do sort of like some screening questions that don't necessarily have to do with your shoulder, but it's sort of appropriate for the times we're in currently, and then address also just some other like general body systems. So we'll sort of do like a yes or no questions for a little bit, and then we'll dive into your shoulder.
Okay, great.
Okay, so do you have any fever?
No.
Any cough?
No.
Any tightness in your chest or trouble breathing?
No.
And any muscle pains or soreness, like body aches?
Besides this, no.
Okay. Do you have any, I know that you're regarding your symptoms in your shoulder, besides the symptoms in your shoulder, do you have other feelings of like numbness on the other side of your shoulder, so on both sides?
Well, I don't have it on the other side of the shoulder, but I have had some like left-sided weakness when I was swimming a lot. I noticed some left-sided weakness, and I also had dropped some things with both hands, but all the other stuff is mostly located on the right side.
Okay.
In the right.
And do you have any numbness or tingling around your lip area, your face?
No.
Any trouble walking or maintaining balance?
I don't have any trouble walking. I have noticed occasionally I'll get like these spots in front of my eyes, and I feel a little lightheaded, and I feel a little like my balance is a little off, but I don't feel like I haven't fallen or anything.
Would you characterize that as like feeling dizzy or just mainly lightheaded?
Lightheaded. Mm-hmm.
And is this just when you like stand up?
No, it's happened not for just one particular reason. It's just happened occasionally. It's kind of just crept up on me.
Okay. And you said you haven't fallen over at all?
Mm-mm.
Do you have any double vision?
No.
Do you have any trouble swallowing or speaking?
No.
Okay. I want to come back to that lightheadedness and dizziness you're feeling.
Okay.
After we just quickly sort of go through your other body systems.
Okay.
Do you have any like chest pain or shortness of breath?
No.
Any palpitations?
No.
Any swelling in your ankles or legs?
No. And
in terms of your sort of bowel and bladder control, is there any issues there currently?
No.
Okay. Do you have any pain with eating?
Like pain in my mouth?
No, I'm sorry, like belly pain, like belly discomfort?
No.
Mm-mm. Okay. No nausea or loss of appetite?
No.
Usually I would hand you a form and you would be able to mark all these checks on it, but since I can't do that now, this is sort of what we're doing. Any sort of abnormal heat or cold intolerance or fatigue?
No.
Okay. Do you feel like you have any decreased attention or changes in your mood?
No.
And you said no double vision, no changes in your vision at all?
The only thing that's changed are those occasional spots, but none of that. Nothing else, I mean.
Okay. Any changes in your hearing?
Well, change is not exactly. I mean, I've had tinnitus for a bit.
Okay.
But that's not new.
Okay. I'll make a note of that.
Okay.
Any new like skin discolorations or rashes?
No.
Okay. So, that's excellent. I think for now we're done with the yes and no rapid fire, so we'll move on. I want to know more about why you've come to PT today. So more about the reason why your doctor referred you.
Because I would like to be because it's not going away, and I'd like to be pain-free, and I'd like to get back to my physical activities that I miss.
Okay. What are those physical activities that you miss?
I've had to curtail a lot of stuff. Now I don't ride my bike to work because nobody's going to work and we're working at home. But I stopped riding my bike to and from work. I stopped swimming. I was teaching a kids swimming class that I really enjoyed. Stopped doing that. Stopped gardening.
Okay.
I'd really like to start doing those things again.
Yeah, absolutely. Now is the time to be gardening too with all this time on our hands.
Right.
So if you could point or tell me about where exactly you're feeling that pain, like if you were to point to it.
It's not in one specific place, but if I put my hand like on top of my shoulder, like right like that, that's pretty much where it is. It does it can move down all the way to the tips of my fingers, but that's the real main part, was right in this area right here.
And it can radiate all the way to the tips of your fingers.
Yeah, it'll feel like numb and tingly. Sometimes it feels like there's like tape on my arms, if that makes sense, like tight. But then I shake it out and it goes away. Like if I fall asleep and I end up sleeping on my stomach with this arm above, then it'll be like super painful. It'll shoot down my arm.
So the shaking it out, doing this thing helps?
That does help, yeah.
And it does wake you up at night if you sleep on it funny?
Uh-huh.
Okay.
To tell you the truth, I'm not exactly sure if the pain wakes me up or I just wake up anyway. But when I wake up, I'm in a lot of pain.
You notice it. It's painful.
Yeah, for sure.
Sometimes
it goes, my hand will go numb and it even turns kind of white.
Okay. It even gets white. Does it get cool to the touch?
No.
Just can get sort of white.
Mm-hmm.
When did you first start noticing these symptoms?
About a year ago.
1 year ago. And what happened 1 year ago?
I fell off my bike and broke my clavicle.
Yeah. I saw that you just recently got a x-ray of your clavicle. So you were riding your bike, fell off.
Yeah, it was windy. I went over some grades and the wind kind of pushed me. I wasn't prepared. And I didn't go straight over and I didn't go straight to my side. I kind of went over and to the side.
Mm-hmm. Okay. Reached out to catch yourself and broke.
Yeah, exactly.
Okay. And then you went immediately and got that looked at, I imagine.
Yeah.
And did you get surgical repair or did they just sort of put you in a sling?
Yeah, exactly, the second.
How long were you in a sling?
For quite a while. I kept it immobile for quite a while. And then, as it got better, I started to do stuff, and that was fine. I figured that there would be pain for a while, because there was break, but I kept on doing stuff because I thought, well, the pain will go away. And I was anxious to do stuff, but the pain never went away.
Okay.
And so that's kind of why I called the doctor and said, this is not work.
Yeah, it's still going on. Do you, by any chance, remember the amount of weeks you were in that sling, approximately, or no? More than 4?
I think it was more than 4. I feel like it was more than 4.
Okay. That sounds about right. All right. So it will travel all the way to the tips of your fingers. So you have numbness, tingling, tightness, and pain.
Yes.
I want to know about the pain in terms of the severity. So right now, in this moment, if you were to rate it from 0 to 10, 0 being no pain and 10 being excruciating ER trip pain, what would it be?
Right now?
Yeah.
I would say a 1.
And what is the worst it's been in the last 24 hours?
Oh, it goes up to an 8.
Okay. And what's the least it's been in the 24 hours? Is it the 1?
No, it's 0. It can be 0.
It can be 0? Okay. Do you have any other associated like body symptoms that come on with those symptoms? Like any other, do you feel like those lightheaded moments are associated at all with these symptoms?
No, I don't. That's a great question, and I really don't know because I haven't I didn't really think about that.
Okay.
So I'm sure if that just happens slowly. Those symptoms have kind of crept up on me, and I haven't really, like I said, associated them. So I don't really know.
Okay. Is there a particular time of day when it is worse?
No. What makes it worse is the physical activity I might be doing.
Okay, so in terms of things that make it worse, this like a sleeping position, prolonged sleeping position, and then any of those activities you told me about. So would it be biking, swimming, and gardening?
And anything that I have to lift my head, like even stuff in the house, if I would lift my arm, I just don't do because that makes it worse.
So like brushing your hair would be hard.
Well, I do it with my left hand, but I'm still not going to blow dry my hair.
Right.
You know what I mean? Because it's like, why bother it? And it hurts. Or like, even dusting up high, those kinds of things.
Yeah.
I'm just not doing it.
Okay. And what makes it better?
Well, not lifting my arm. And also, sometimes I'll rest it on a pillow, and that feels really comfortable.
Okay.
But I don't guard it. I mean, I use it normally. I just don't lift it up.
Okay, it's when you get it sort of like above shoulder height.
Yeah. It doesn't hurt if it's good if it's just normal. I can do things down here. I just can't do with my right hand like this stuff. It hurts if I go up like that.
Okay. And say you started to dust overhead.
Yeah.
How long until that onset of that pain?
Not very long at all. It happens pretty darn quick. It starts, not acute, and then it builds and builds and builds if I keep doing it.
Okay. So we'd say essentially immediate onset. Does that sound right?
Virtually, yeah. I mean, it might be a few seconds, but I think that would count as.
And you could go from a 0 out of 10, or 1 out of 10 right now, to when it was sort of that onset. How bad does it get?
Well, the longer I keep it, the worse it gets. So, for example, if I fall asleep and I end up in that position, it can be excruciating because if I've left it there for a really long time, that's when it's really bad.
So the longer it's there, the worse it is.
Yeah.
Okay. Have you had any other prior to you having the bike accident and breaking the clavicle, have you had any previous episodes of these types of symptoms?
No.
So this is the first time you've never got that numbness or tingling down your arm?
No.
Okay. Are you seeing anyone else right now regarding your shoulder pain besides your doctor? Okay. And how many times do you feel like it's interrupting your sleep, or do you feel like your sleep's normal? You said you just wake up and it's there.
Yeah, I'm not sure which comes first.
Okay.
The truth.
How many hours of sleep do you get a night usually?
Oh, I don't know, 6 or 7.
6 or 7?
I try to get 6 or 7. Sometimes it's a little less, but that's because I'm working, or it's not that my arm keeps me up at night.
Yeah. So, prior to your accident, you were riding your bike about how many miles a day, or how long?
Yeah, I ride it twice a day from Fremont to Queen Anne, and then Queen Anne back to Fremont.
Okay.
And then sometimes on the weekend, but I always do the weekday commute.
And then swimming. How often were you swimming?
3 times a week I was swimming laps, and then 1 time a week I was teaching a kids class.
That sounds fun.
It is fun.
And then how often were you gardening?
Well, in the winter, not at all. But in the spring and summer, quite a bit. Like I'd come home from work, and it was a nice way to kind of decompress from the day. So I'd spend half an hour, 45 minutes, an hour doing some stuff, and that was pretty. And then of course on the weekend more because I enjoy it. So I was spending, gosh, a lot. A few times a week, and on the weekend too. So 4 times maybe during the week.
Okay. Yeah, it's the time to be out there.
Yeah, exactly.
And then currently, in terms of bike riding, swimming, and gardening, are you doing like none of these? Zero?
Zero. The only thing I'm doing is of those things, I'm riding a stationary bike at night.
Okay.
In the evening after I'm done with work here at home, because I'm telecommute. I'm not really going to be there.
Yeah.
So yeah, I do that in the evening.
So and then 5 days a week?
Oh yeah. Mm-hmm.
For how many minutes?
I would say 60 minutes.
Awesome. And does that aggravate your shoulder at all?
Because I don't sit like that. I just sit up and do it.
And use your legs. Okay.
And I just use my legs. And then in the morning I go for runs, and that doesn't bother it.
Oh, okay. How many runs per week, and about how long?
Oh, for sure 5 days a week, sometimes 6. And I go between, I would say, 2 and 5 or 6 miles.
Okay. Depending on the day?
Depending on the day, I don't want to have an injury, so I'm careful.
Yeah.
But I also feel like I have to do it, otherwise I'm going to stab my eyes out because I'm so,
Cooped up a bit?
Cooped up, and it's not just cooped up, it's my work. I sit.
Okay.
And that's not my normal, that's not where I'm comfortable. I love my work, but I hate the sitting part. So
tell me more about what you do for work.
Yeah, I work for the Gates Foundation. I'm a grants evaluator.
So you're on your computer all day?
I'm on my computer, I'm in meetings, I'm in phone calls, and I'm sitting on my behind the whole time. So okay. It's really imperative to me to move.
Yep, for sure. And that's full-time, 40 hours a week?
That's correct. Okay. And sometimes more, but
Right, when duty calls.
Yeah, exactly.
Do you have any other pertinent medical history that it would be important for me to know? Any other diagnoses?
Yeah, I do. I forgot for a second. I have a condition. It's a chronic condition called S protein deficiency.
Okay.
And this has not impacted me at all, but I had rheumatic fever when I was a kid, and I have a heart murmur, but it doesn't impact my exercise or life or anything.
Okay. And how does the S protein deficiency affect you at all?
Well, I had a arthroscopic knee surgery 10 years ago, and because of the S protein deficiency, I got a DVT. And so I'm prone to those. That's kind of that's the problem with this condition is you can get those easily.
Okay.
But so far so good. So after that one, so far so good. I really take good care of myself, or I try to, and so I've been, which is why I need to, I don't want to sit too much because it's not good for me.
Yeah, and that DVT, they were able to it resolved without, okay.
Yeah.
And when was that surgery? What year?
That was 2010.
Okay. Okay, so the S protein deficiency and the heart murmur from the rheumatic fever, that arthroscopic knee surgery, any other prior surgeries?
No.
All right. Have you been in PT before?
After I did my knee, I had the option to go to PT, but they gave me a list of exercises, and I did them because I'm good. I mean, I didn't stick around, so yeah. I wanted it to get better, mm-hmm. so I could do more stuff. Mm-hmm. So then the sheet that they gave me was great because I did the things, and then so I didn't have to go to a follow-up PT. I could have, but I didn't have to.
Yeah, and then you were able to just go right back into all your activities, no problem.
No problem.
Wow, you're the dream patient who does her exercises.
Well, I don't understand why. I mean, it just doesn't. If you want to get back, I mean, I would see if you didn't come to PT and you didn't want. But if you come to you guys, then Do what you say, right?
Yes. Yes, you should talk to some other patients.
I bet it can be frustrating, but I think that's in any work.
Yes.
In my work too. It's like, why are you? Okay, I don't get this, but
yeah. Ainsley, do you take any medications,
I
prescriptions?
don't.
Okay.
I take occasional ibuprofen. I don't know if that counts.
Okay. Use ibuprofen. Do you ever use ibuprofen for your shoulder pain?
I have tried to, but then I thought, look, I don't want to start doing that all the time because that seems like a bad end. And I've done it for an occasional headache, or if my muscles are stiff from running or something, and
yeah.
stuff like that.
Does the ibuprofen help with your shoulder pain? Does it lessen it?
Not really.
Okay. And do you have any allergies?
I don't.
And I want to know a little bit about your home.
Okay.
Just so I can understand what your setup is like. Do you live in a house, an apartment?
I live in an apartment.
Okay. And do you live in your apartment just you?
No, I have a roommate.
Roommate. Okay. And do you have are there any things about your apartment setup that your shoulder pain sort of makes it hard to get around besides the dusting or cleaning?
No, not at all.
No? Okay. Do you smoke cigarettes?
I do not.
Do you drink alcohol?
I do not.
And do you use any recreational drugs?
I do not.
Okay. And you said that the dizziness doesn't make you fall.
That's correct.
Have you had any falls other than that? Like there's no history of falls?
Right.
Okay. So I want to know a little bit more. Do you get your blood pressure checked regularly?
When I go in, I do.
Okay, and has anyone ever told you you have low blood pressure or anything like that?
Right, they always say I have good blood pressure.
Good blood pressure. Okay. And when you stand up and you're feeling, or I'm sorry, it's not just when you're standing up. You get these sort of numbness, the dizziness and the lightheadedness just whenever. Sitting down, standing up, walking.
Yeah, I haven't noticed that it's a particular time.
Okay. So, trying to think here, just make sure I checked all my boxes. Is there anything else about your shoulder pain that you think is important to tell me that I have not asked about?
I don't think so. I feel like I've told you everything.
Yeah?
I really do, yeah.
Okay. Okay, great. So I don't have any more questions to ask you currently,
Okay.
but I am going to recommend we can do an exam and do some tests to sort of try and see what might be going on with your shoulder. Your doctor thinks that it is something called thoracic outlet syndrome is what he wrote, which is a mouthful. So you can just call it TOS for short.
Okay.
And that can sometimes be caused if you've had, sometimes it can be caused by sort of the way our bodies are shaped and our own anatomy, or sometimes due to injury. And it's essentially, we have a bunch in the front of our shoulder here, we have a lot of vascular, so a lot of arteries and veins and a lot of nerves. And if any of those get sort of pushed or smushed or pinched on, that can sometimes cause feelings of numbness and tingling and pain. And so I would want to do a few tests to check on that. But because of your history of that DVT and the symptoms you're feeling in terms of the lightheadedness, sort of that's not dependent on just sort of like getting up, I want you to go and check back in with your PCP and have them evaluate that. Did you have a chance to talk to your doctor about those dizzy spells?
I didn't know. I didn't actually.
Yeah, what I would like to do is that we can do this exam, and I can do a few tests to check on in terms of the TOS, which is the hypothesis your doctor had. I think it's totally valid to check in on that. But I want you to schedule an appointment with your PCP, talk to them about these dizzy spells,
Okay.
and just get that checked out.
Okay.
Yeah, I think that would be the most prudent approach, just because of your history.
Okay.
I think that would be the safest thing to do.
Okay, I'll do that.
Do you have any questions for me?
No, so it just seems like that's the order I need to do it. I need to go back to my PCP, tell them about that, and then maybe we'll take it from there.
Then we can sort of like get that covered, and then we can proceed with checking out and seeing if it's, is this from the clavicle fracture that you had? There is a little bit of incongruency in terms of how it healed. Some people are asymptomatic and it's not a big deal, and some people have a few symptoms. Okay. Also, you have, I'm not sure if he told you, but in your x-rays, you have a rib, a little tiny baby rib coming off your last vertebrae in your neck, which not everyone has, but some people do. Sometimes it can put people at a higher risk for developing sort of those TOS symptoms of that numbness and tingling.
Oh, okay.
But because you didn't have that, you've never had any episodes of that before, and you've obviously had these those little ribs there on the seventh cervical neck vertebrae. That's sort of why I want to get this dizziness that you're having checked out first.
Okay.
Before we sort of go down that road.
Okay.
Yeah.
Okay, that makes sense, and that sounds good. Okay.
Okay. Great.
Okay, thank you. That's awesome. Is there anything else you want to tell me or say?
I don't.
Are we done?
We are done.
No, I'm not telling you need to.
Okay.
No.
No.
No, absolutely not. You don't. But if I just want to make sure, I don't want to cut you off before you're ready. Are you ready?
I'm ready. Thank you.
Okay, awesome. Tell me what you think you did well.
I think I did a lot better job than I used to at getting the information I wanted, and it's hard to start with. There's a lot of information that has to be front loaded, I feel like, in terms of getting the yes and no stuff out of the way to make sure I have it, and then diving back in and getting to the nitty gritty. And so I felt like it was a good decision on my part to do that right off the bat and sort of just get it done. It gives me a lot of information pretty quickly.
I couldn't agree more. I thought that was an awesome choice.
Cool.
You got so much information in an insanely short time.
Awesome.
I was looking at the clock going, I can't believe she did this quick, and it doesn't feel rushed in the least.
Oh, good.
I felt like we were, talking. I think there were moments where you really established nice rapport with me. You kind of made a personal, I don't remember what it was, but they were great. Whatever it was it would be like an off, track. It wasn't off track. I don't mean off track. It was perfect. It was when you engage in somebody personally, but you're still paying attention and doing everything.
Yeah.
But it makes the patient feel like, oh, wow, we have rapport. This person is empathetic. They're really paying attention. And it's also a friendly, professional, but friendly interaction, which that's what you want. Yeah. I mean, I would come back to you as a patient absolutely without a doubt.
Oh,
the way you told me what to do at the end without scaring me was awesome.
Okay.
Because I really would go see my PCP, but I wasn't freaked out. So
right.
That was awesome. I'm going to go through everything because you did an exemplary job.
Oh, thank you.
You had a great intro. I loved how you did that beginning. That was beautiful. You explained everything very, very well, but you didn't talk down to me. So that was awesome. Your pacing was excellent. It seemed very leisurely, and I don't mean that in a lackadaisical way. It seemed like you weren't rushed in the least. So that was awesome. You were very clear, nice summarizations. You used summary, which was great. I just kept on writing, very good, very good, very good. You were very thorough, and you did a great job explaining. Said this again. It felt conversational. It flowed easily, and yet you got a lot of information from me. You probably got the most of anybody. Probably shouldn't say that, but anyway, it never felt rushed. I can't believe you got all that information in such a short time. I also something could have been not good, and you made it good because when you look away, that that you lose that connection.
Yeah.
But you told me right away what you were doing.
Yeah.
So you didn't wait to tell me. You said it right away, which I thought was great. Because if you have to do that, then the way to get around it is to say, I'm, what you did. I'm sorry, I really am, but I'm. And then when you could look, you did look. So you didn't just stay glued to this.
Yeah.
The one technical note I would say is the space is great. It seems very, professional. But the light that's coming through the back sometimes blinds your face.
Yeah.
So sometimes it's perfect and sometimes it's not. So if you had to use this again, maybe to do a shutter,
okay,
or maybe switch whether you can do. But that's a completely technical thing. But it's something that you want